Hi everyone, I am Stephanie with Nine Health. Let me make sure our live stream is going before we get into everything today. I want to focus on our kids' health. I'm a mom of two. One of my kids is 4.5, so we had to make the choice of remote learning or virtual, or not remote, or virtual, remote or in-person learning for his school for just pre-K. But it's a tough decision a lot of parents are making. And just making sure we are live. We are live. Okay. If you have questions about kids' health, going back to school, I have Dr. Payal Kohli joining me, and I'm health expert Dr. Payal Kohli, and Tamara Acevedo with the Denver Public Schools. She's the Deputy Superintendent of Academics. Again, you can ask us any questions. I'm just making sure this Facebook is going and set up, and it looks like we are good. So again, talking about kids' health, it's back to school time, and obviously back to school looks a lot different this year. So we want to just talk about what that looks like. Cases are kind of going up in kids right now. So I want to talk to Dr. Payal Kohli about that as far as COVID-19 and our kids' health and how it's affecting our kids. But I want to start with you, Tamara. Can you give us the latest from Denver Public Schools and just the plan for the upcoming school year?
Yeah, absolutely. And Stephanie, I'm also a mom of a student in DPS and a ninth grade student. So I had to make the same exact choices you have in terms of remote instruction. But really right now in Denver Public Schools, we are currently, the plan is a remote start for all students until through October 16th, right at this point. And that's really been based on our current health conditions and what we've been seeing. With that planning, we really learned a lot from the spring about what's worked well in the remote environment in terms of learning and what hasn't. So we really, as a school district, have been focusing our efforts on really ensuring a robust remote learning program for all of our students. So that's really meant standardizing some key elements in remote instruction across the board for all schools. And part of that standardization is our learning management system. So that's really the platforms that our students and our staff, our teachers engage in. And we've tailored our curriculum to be part of that learning management system and to be used in a remote fashion. We've also been doing a lot of work to continue our focus for curriculum instruction on our curriculum being more culturally responsive. So it's really important that that work continues in the remote environment or the in-person environment.
Yeah, and as I mentioned, we're talking about our kids' health going back to school. We're talking about Denver Public Schools and Nine Health expert Dr. Payal Kohli. As Tamara just mentioned, DPS is virtual at least through the first quarter, throughout the start of October. Dr. Kohli, while they're virtual, some districts are offering in person. I think Cherry Creek starts on Monday with in-person instruction. Or, some schools are offering a hybrid, giving the parents the power to choose as well. I know my son's school, he's in 27J, District 27J, Brighton schools. We can choose between remote or in person, but we have to stick to that choice for the semester. So that was a tough decision to make too, to weigh those, pros and cons. But for kids that are going in person, can you give us some of the latest about cases in kids in our state? And in your opinion, is it safe to return to school in person?
So, we have seen, just like on the national spectrum, the cases in kids here in Colorado have increased as well. In fact, according to the CDPHE, in the last week, cases in kids aged 0 to 9 have increased by 60%, and cases in kids aged 10 to 19 have increased by 69%. And unfortunately, increased cases also means more kids in the hospital. So we've seen an increase in both groups occurring as well, with about a 14% increase in hospitalizations occurring. So I was quite alarmed when I saw the numbers here in Colorado, where 10.4% of our cases in Colorado are in kids under the age of 19. So that's 1 out of every 10 cases that's occurring in kids under the age of 19. And what we've learned from science in the last few weeks is that kids can both catch the virus, harbor it, and spread it to adults. And we know from a study in South Korea that kids over the age of 10 spread the virus at least as efficiently as adults. There was also a study that came out last week in JAMA Pediatrics that looked at the viral load, or the number of virus particles in the nose and mouth of kids under the age of 5. And what they found is that these kids have 10 to 100 times the virus compared to their older counterparts in their nose and mouth. So even though younger kids may not spread it as efficiently, they certainly can harbor it and have a lot of virus, in their nasal passages. And we have to think about considerations, as you said, not just about the risk to kids themselves, but to their teachers, to their vulnerable parents or grandparents who they may bring the virus back to. And as we're now seeing more cases go up, there's a few reasons for that. The first is the cases in the community go up. So here in Colorado, that's not really the explanation, because our new cases have been going down. Despite that, we're seeing an increase in kids. So the second reason is we're testing more in kids than we had been before. So up until recently, we're mainly testing symptomatic adults. Now that we realize kids can also potentially catch this virus, we've started to test more kids. And we know that kids tend to have a higher incidence of being asymptomatic or minimally symptomatic. The third reason is that kids are congregating more. And we know the virus spreads from person to person. So as you bring the kids together, it is going to make the spread more efficient. And then the final reason is that, kids tend to be in that group that may not practice social distancing, may not have the best hand hygiene. They may not wear masks properly. So that could also help to facilitate the spread of the virus.
Yeah, and we're getting some comments coming in on Facebook, so I'll pass some of those along to you guys, and people are just saying, after what you said, Dr. Kohli, people are saying, well, why would we go back to school in person then? It doesn't seem safe. And I think you kind of touched on this, but our cases up slightly in kids as well, just because we have increased testing some?
That is part of it, Stephanie. And I have to say that this is really a decision between a rock and a hard place, because keeping kids out of school has a lot of disadvantages, not just for their social development, but for their educational learning, for their hitting their milestones. For a lot of kids, it's a source of food and babysitting for their parents. And so there's a lot of advantages to really trying to get kids back in school. Can it be done safely? Yes, in certain communities it can, if the cases in the community are low and the school is following the proper precautions. But if your cases are going up, and the community, there's widespread transmission of the disease in the community, then we really have to think about at-home learning for the time being, because when we get the kids together, it is going to facilitate that spread.
Yeah, and again, I'm also joined by Tamara Acevedo, the Deputy Superintendent of Academics for Denver Public Schools. Tamara, DPS seems to be doing a good job of keeping parents informed. I know you guys are doing daily Facebook Lives, I believe, to answer questions. And 9 News did a story this week that you guys are also doing, a couple telephone town halls next week as well. Can you talk about some of the most common questions you're getting from parents?
Sure. I would say two main areas that we're getting questions on are really, what is remote learning going to look like? Especially in light of the fact that we're starting off the beginning of the school year in that way. And then the other is really in regards to health and safety, and where we're at, what we know, precautions we're taking. In terms of remote learning, a lot of the pieces I talked about really the questions around learning loss. So we engaged in remote learning from the spring, right? What has been the impact, or what will be the impact on where kids enter the school year based on their spring experience? And what are we doing to mitigate that as a district? And so, we've had a really intentional effort to, with the changes and the updates to our curriculum, also include areas within the curriculum for what we call unfinished teaching and learning. So they're key core learning milestones, learning pieces in the progression of learning that we've embedded into our scope and sequence of learning so that teachers can address that along the way. So we're accounting for that. The other thing in terms of the questions for remote learning would be around engagement. And so we've increased in our remote learning plan the amount of synchronous instruction or live instruction for all of our teachers and students. And then also within remote learning, what are we doing to connect to social emotional learning? Because that relationship and that connection in the virtual environment is critical and key. So we've included in our remote learning plan daily social emotional learning for all students. In terms of some of the questions for health and safety, while we've really prepared for a return to in-person learning by by right now creating guidelines and protocols. We've also done things like provide free testing for our staff, securing plenty of PPE, hand soap, sanitizer, cleaning supplies. And our ultimate guide for health and safety is what our health experts are saying and telling us. And we've got a strong connection there. We just want to, and we've been telling families, we just want to ensure families that we are in constant communication with DDPHE and Denver Health on how we can safely reopen schools when it's time to do so.
Yeah, and we got a couple of questions that I want to pass along to you about remote learning. Someone asked, if we do remote learning, how does the state testing happen? I'm guessing like standardized tests. And then someone also had asked about, does every student get a computer or a tablet? So maybe you can answer both of those questions.
Sure, and we're consistently working on testing as a whole. And I'll say, like, for the start of the school year, we always have beginning of the year testing and some diagnostic testing to really see where students are at. What we've done as a district, we've worked and planned to have that testing be done in a remote environment, a virtual environment. So we'll prepare and plan for that, continue to do that throughout the remainder of the year, and continue to get updated guidance from the state and CDE. In terms of devices, I think your question was, will everybody be provided a device? And yes, that is the goal. Right now, we have our annual family update going on, and that's where it's our registration process. It's an opportunity for our families to go ahead and say if they need a device or if they have a problem with the device that we issued them previously that they need to change out and get an updated one. We've also ordered more devices, and we have around, I believe it's 4,000 devices that we're going to be distributing that we have in-house. So yes, it will only work if we can ensure that our students have access to devices. And in addition to what we've handed out in the spring, we have a plan for making sure that all of our students start the year with devices.
Right, and again, Denver Public Schools is starting remote for the first quarter. Across the board, and people are asking, why are we gambling with our kids, risking their health for any in-person learning, because some districts are going back in person. For those, Dr. Kohli, that are going back in person, can you give advice to parents and kids really too, some tips just to keep them safe and healthy if they have to go in person?
Yeah, so I think you really want to think about two things. First, who is your child? And I like to break it up into different age groups. So if it's an elementary school kid, the big goal there is going to be to teach them how to be safe, because they don't understand the science of transmission. They don't understand about masks being efficacious. They don't know that hand sanitizer is not edible. They don't always wash their hands well. So with elementary school kids, I think it's about incorporating those practices at home in their routine, whether it means using stories or superhero costumes or whatever, to try to really make that part of their culture at home, so that when they go to school, they continue to propagate those types of behaviors. With middle and high school kids, it's more about compliance. So often they understand how it's spread, but they don't want to wear the masks, or they want to see their friends, or they don't really understand why they need to stay away from each other, or avoid large gatherings. So for them, it's really emphasizing the compliance piece of it. And a lot of pediatricians are saying the way to do that is to either reward them for good behavior, or to kind of sit down and explain to them why they need to be compliant. It doesn't just affect them, but it affects their entire community and has downstream effects on other members, including their family members. And then for college kids, it's really not just they know the science, obviously, they hopefully understand they need to be compliant, but they have a lot of exposures. So on a college campus, you're walking around, you're going to the dining hall, you're going to bars, you're going to lecture halls. And so it's really about managing their exposures, keeping those at a minimum, and also trying to use testing as much as possible. So a lot of people are recommending regular testing for college kids at least once a month, and possibly even more frequent every time they may have an exposure, because that's a good way to kind of manage their risk. So I like to break it up into those three age groups for the kids, and then talk to the school. That's really important. Try to understand if your child has special needs or is vulnerable, whether or not it is safe for them to come back to school if they're in a vulnerable population. And then the last thing to consider is whether or not you have somebody vulnerable at home that the child could bring the virus back to, in terms of making that decision about in-person or remote learning. And if you do, then you may want to keep them separate, or have the grandparents move out, or have the child tested before they see the grandparents, before they interact with them.
Yeah, and again, we're talking about kids' health, safety, the upcoming school year. A lot more to think about this year. As it kind of makes my head hurt, just everything we're talking about. It's not just about school supplies and the first day of school outfit this year, and it's a lot of other things as well. And we're talking a little bit about, there's some groups of students that would benefit, of course, from going for in-person learning. Someone did just comment that kids with special needs need that in-person learning. Tamara, DPS has said that they'll bring small groups of students identified as high priority for in-person learning sooner than that October deadline, or I guess date, for the first quarter. So who are those high priority groups, and why do you think in-person learning is important for them?
Yeah, it's a great question. Thanks. The pandemic has really exacerbated the inequities in our culture, and we at Denver Public Schools really have identified with this and see this as a need. And so I'll preface my response by saying that these are ongoing conversations that we're having as a district and that we're still working through. But we have worked with our educator-led return to school work group on this, and continue to work on this. And the group has looked at English language learners, students with special needs, as you're getting call outs on the comment section, our youngest learners, and other groups that really just need additional support to thrive in a learning environment. So our goal right now is to bring in these smaller groups back for in-person learning as soon as September 8th. But of course, we're going to we will share more information as soon as we're able to, and we have those details worked out.
Yeah, and it's a lot to work out. And as I mentioned earlier, Denver Public Schools is doing, if you're in that district, they are doing weekly or daily Facebook Lives. They're holding 2 telephone town halls next week. 9 News did a story on it the other day. I can post that in the comments so people can see that as well. Also, the info on all the districts. 9 News has a great story that breaks it out by district as far as what each district is doing and what their plan is right now. I think the hard part is, things keep kind of changing. It seems everything's pretty, in place right now, but up to even a week ago, things kept changing and districts were changing plans. And I think even my son's school has moved to September 1st as a date now to start. So things do keep changing, and it's a lot to keep up with. Dr. Kohli, someone did just comment about this as far as if kids get it, they're more asymptomatic, their symptoms are milder. When all of this started, we kept hearing that kids aren't really affected by COVID-19, but now we're hearing that with more testing positive, how high is their risk of COVID-19, and what are their symptoms looking like if children get it?
So some studies estimate, one in published in Science, that kids are about 1/3 as likely as adults to get COVID-19. But you can imagine, as kids are going back to school, some modeling data has shown us that on an average school day, they may have 3 times as many contacts as a typical adult would. So if their risk is lower, but they're having more contacts, it kind of becomes a wash, and they become about equivalent risk to adults. Now, as you pointed out, greater than 90% of kids have mild or no symptoms, which is good news because their immune systems are a little different than the immune systems of the adults. Their first line responders are a little bit stronger because they haven't seen as many organisms. So their innate immune response, which is that first line of defense, keeps that virus at bay. It makes it less likely that they'll end up in the hospital or have severe complications. Now, the symptoms are quite similar to those of adults, with the 2 most common symptoms being fever and cough. What's different with kids is that they're a lot less likely to have that shortness of breath because it's a lot less likely to get into the lungs. Kids can also have other symptoms like a stuffy nose, sometimes abdominal symptoms like nausea, vomiting, or diarrhea are also more common in kids. But as we talked about, some of them can have no symptoms at all. So really kind of keep a pretty high threshold if you think your kid may have been exposed to get them tested, or if they have any sort of mild symptoms that you're not sure about, to go and have your child tested.
And Tamara, just speaking logistics again about remote learning, virtual learning, we asked the question about getting devices to kids, but what about Wi-Fi? If a family doesn't have Wi-Fi or can afford Wi-Fi, what is the plan there?
Yeah, we have, I mean, the devices and the internet access are, we're working on both of those simultaneously. So we're also, our schools are divided up by regions. And each of our regional teams are working with school leaders to review the data on who has access to internet and who doesn't, so that we can provide plans and or hotspots for students and families to be able to access. So that is definitely connected to, we're not only getting out devices, we're also really focused on making sure that all of our students have access to internet.
Perfect. And then one of my questions, you've worked as a teacher in the past. As parents with students in Denver Public Schools prepare to start the school year remotely, what are some ways to set your kid up for success? I kind of struggle with this. My kid, again, is only 4.5. We're just doing pre-K and we are starting out remote. We just have a little tiny desk in my office, but he doesn't have like his own setup or classroom. So what are some good ways to set him up for success?
Yeah, it's a really good question, and I definitely relate. I mean, some of the tips that, I'll give you sound simple, but they really help set the foundations for success for the start of the year in remote learning. And so one you've started to mention with your own child, it's really important to designate a quiet space for your student to do their schoolwork. It really helps to get them into a more focused mindset, a school mindset, when they have that dedicated space with their materials whenever it's possible. To have a schedule, you talk about your child who's a young student, so a schedule that is adequate for the age of your child, but that also gives your students your child a sense of routine. So it really makes it easier for kids to develop good habits when it's built into a routine and a normal day. And also for our parents and caregivers to not underestimate the importance of social emotional learning. I talked a little bit previously about how a remote learning plan will include that on a daily basis. And I think it's important for us as parents and caregivers to also talk with our kids about how are they feeling, give them the time and space to process everything that's going on. This is still very new. And to talk about how school will continue to, or how it's going to look and feel different, whether it's the start of the school year with remote or we're transitioning into in-person. Change can be very difficult for students, and it's important that we talk to them about that. And then lastly, just to continue to keep health and safety a priority, and have those, make sure that we're doing that with our students. So making sure that they're wearing a mask, washing their hands frequently, practicing social distancing. We say, that the small actions here will really continue to make a big difference for all of us getting closer to movement into, for us as a district, into in-person learning.
Yeah, and I know, my son again is young, but my grandma just sent me a Wall Street Journal article the other day about the importance of development and socialization from 2 to 5. And, by the time they're 6, that window's closed and they've completely developed socially. And I'm like, oh goodness, at least he went to daycare for a little bit, but now he'll be remote for a little bit. And you talked about social emotional learning. I'm just curious, this is just a question for me, but what will that look like for DPS? And is that across all age groups?
It is across all age groups. And we actually, there'll be a minimum core instructional time for that, meaning it's part of the live instruction that'll occur, minimally 20 minutes a day. And what we've been focusing on professional learning with our teachers with a session last week that talks about the practices you use on a daily basis. And so you can think about, some of the tips that I just gave you as a parent checking in. There's similar pieces that our teachers will do checking in with students as well on a daily basis. How are they doing? Building relationships? How are they accessing learning? What are some of their fears? How are they negotiating that? And then also so that they can connect to any social emotional health supports that are within the school system that you would typically connect to on in an in-person environment. Practices of social emotional learning, we're training our staff on, and daily social emotional learning practices in classrooms for a certain amount of time.
Yeah, that's great. And Dr. Clay, I don't know if we're going to wrap up here, but I don't know if you want to add to that at all as far as the mental health aspect of, it's hard for in both cases too, because the kids that are going in person have it completely different with wearing a mask and being socially distant from their friends. So that kind of probably has some mental effects as well, even though they get to see their friends in person. But for those that are remote learning too, what are just some ways we can help take care of our kids' mental health right now?
Yeah, I think we've made a lot of excellent points. I will say the CDC from the very beginning of this pandemic did identify kids and adolescents as one of the high-risk populations for having mental health problems in coping, not just because of limited understanding of what's happening, but also because it does have such a profound impact on their social and emotional development. And we've talked about this before for younger kids, particularly elementary school kids and adolescents. They're really learning how to socialize by looking at adults, emulating them, looking at their facial expressions, looking at each other. And a lot of that would be taken away with some of the in-person learning, wearing the mask or wearing, other types of PPE where that can't occur. So I think the most important thing parents can do is just be aware that every child is at risk at this point and really be tuned into any kind of changes in behavior that could indicate that your child may be starting to have an impact. And what the preliminary studies have shown us is that kids of all ages, all the way from elementary school and toddlers, even up to teenagers, have started regressing. And regression is a way in which a lot of children declare early onset mental health disorders. So for a toddler, it might be that they used to be potty trained and now they're having accidents. And for an adolescent, it might be acting out and throwing a lot of tantrums. And don't blow that off as natural teenage tendencies, but just be tuned into that. And then for those older kids, be really tuned in as well to substance abuse problems, which have increased in adults as well as in the teenage community, and which we know can really spiral out of control during these types of stresses.
Yeah, all good points. And hopefully we've covered some of everyone's questions. I went through Facebook again. I think we've answered most all of them. I want to thank you both for joining me. Before we go, I need to remind everyone to make sure you're the healthiest version of yourself during this pandemic. 9Health has a bunch of tools you can use. We have free mental health tools at 9healthfair.org, not necessarily for children, but for adults. Check in on your mental health. I can post a link to that in the comments. Also, we have our new 9Health Discovery Kit. Those same screenings you used to get at a 9Health Fair, we are now offering at Quest Diagnostics Patient Service Centers. $35, you can get your blood chemistry done. That's 28 levels of health information. So it's a great baseline to get that done. We are also offering COVID-19 antibody testing, vitamin D screening, blood type. There's a bunch of different screenings. I'll put the link again in the comments for that as well. And if you have any medical questions or health questions you want answered, we are still running our 9Health Neighbors line. It's run by 9Health medical volunteers. You can call 303-698-4455, extension 2005, leave a message, and within 24 hours, a 9Health medical volunteer will call you back. You can talk to a real person with all questions that you have regarding mental health, medical health, anything that you really want to talk about. And that's really all that I have. Thank you both, ladies, both for joining me, and we'll sign off from here. Thanks so much.